Welcome to the Cambridge Financial Podcast with Bert Salazar, CEO at Cambridge Financial Partners, LLC. This podcast is all about tax-preferred retirement planning, economics, financial risk management, and achieving a risk-free and successful financial life. Now, your host, Bert Salazar.
Good day, everyone. Welcome to another exciting Cambridge Financial Podcast from the Cambridge Podcast family. Last week, we did a very interesting podcast in which we received a tremendous amount of accolade. And last week's podcast was based on how much do you know about Social Security and retirement. Today we're going to do something that is very close to Social Security, which is Medicare. So today's podcast is titled, How Much Do You Know About Healthcare and Medicare Costs in Retirement? And that is one of the major problems that we have in the marketplace as we deal with clients that are preparing for retirement. Most of them truly have very little understanding of what it takes to retire properly and how much preparation needs to go into the retirement process. And that's something that we try to address every single day as we approach clients from a retirement perspective. Now, there are a number of healthcare challenges that we're going to be discussing today. For example, 4 out of 5 people cannot accurately estimate how much they're going to be paying or expected to pay for health care in retirement. Why? Because most retirees don't really pay much attention to that. You know, they're thinking about the investments that they have, what they're hoping to receive from those investments in reference to an internal rate of return. Very few times do they forecast Medicare premiums, Medicare costs, and so forth. So we'll try to address some of that for you today. Again, for instance, out-of-pocket healthcare cost for the average 65-year-old couple today, can reach $220,000 over a 20-year period. And whenever we mention that to the clients that we're engaging, they're totally confused and they can't seem to understand how it is that they're going to be paying so much. And that's only for 20 years. What happens if you live a long life? What happens if you live 3 decades? So you're 65 years of age and you're still alive at age 95. Those costs obviously are going to be enormous and they need to be addressed from a business standpoint. Now, one of the challenges that we have is getting our clients and our friends, to make a paradigm shift as to how they think about retirement planning. And one of the things that we always try to emphasize is that, the rules of engagement completely change when someone enters retirement. It is no longer about the accumulation rate. It is about the distribution rate. So trying to obtain the highest distribution rate for your money and your assets in retirement, it's a lot more important than trying to stay ahead, by taking risks and getting a higher accumulation rate. Now, prior to retirement, all of us have certain risks that we need to deal with on a daily basis. For instance, if we're putting money away for retirement, obviously market losses and interest rate volatility, can hinder performance over the long term. Now, the market has been doing fairly well for the last couple of years, but there's going to be a day when the market is not going to do that. And as a matter of fact, if you happen to enter in retirement in a period where there may be 2 or 3 consecutive years, as we've seen in the past, of negative market returns, it can really have a negative impact on your retirement planning from a business perspective. The second thing is inflation. I always say in all my podcasts and webinars that inflation is not tax deductible. So inflation is creeping up. Now, obviously, if you pay attention to the government statistics, they'll tell you that inflation in the United States has been fairly civil, for the last few years, and it has been. But by the same token, there's a big difference between the national averages and the personal inflation rate. Obviously, the CPI doesn't take into consideration things like food, medical cost, and obviously gas prices, and energy. So those are things that you also need to add up as you start to figure out your personal inflation rate. And then you'll realize that for most of us, our personal inflation rate may be as high as 5% per year. Let's say a 4% per year or a 5% per year. That basically means that if you have $1 today, next year that dollar is going to be worth either 95 cents or 96 cents. Or next year that same dollar is only going to be able to purchase 95 cents or 96 cents of, goods and services. And last but not least is taxation. We pay a tremendous amount of attention to taxation because taxation is a major cause of retirement and retirement failure in the United States. Now, once you get into your retirement years, obviously the rules of engagement change. So not only do you have the same issues that you have while you were working and you were putting money away for retirement when it came to market losses, interest rate volatility, inflation, and taxation, but now you have other issues that you need to pay attention to. For instance, outliving your assets. One of the major things that we try to make certain that our clients plan for is you want to make certain that you don't run out of money before you run out of life. And many of our clients, although they've done fairly well financially, when we start to put all of their assets and their needs and objectives in economic models, we start applying pressure to those economic models, many of those clients will run out of money before they run out of life unless they do proper economic planning. The other issue is providing a surviving spouse income. Obviously husband and wife married at age 65, one of them is going to go first. It's usually the husband. So you want to make certain that those assets that you have in place prior to retirement, not only is it going to take you through your retirement years as an individual, but is also going to provide a survivor benefit to whomever lives the longest from that perspective. And then on top of that, you have to start adding health care costs in retirement, and those can actually creep up when it comes to dealing with them and how to paying for them from a business perspective again. Now, many of my clients, as we start to engage them in Social Security calculations and longevity planning calculations and Medicare calculations, one of the questions that they ask is, well, won't Medicare pay for all these costs? And the answer is that it will up to a certain level, but for most, I would say anywhere between 96 and 97% of all my clients, only a very portion of all those expenses will be paid by Medicare. Now, Medicare eligibility carries a cost as well. Now, for instance, 32% of the cost of Medicare goes toward Medicare premiums for parts B and D, and I'll explain that in a few minutes. 23% of that cost goes to cover the out-of-pocket, prescription and drug expenses that Part D is not going to be able to cover. And then 45% of the cost for Medicare goes toward Medicare co-pays, cost sharing alternatives, and deductibles. So it's not just the Medicare premium that someone may be paying on a monthly basis or on an annual basis. It's all about the additional costs that are associated with health care that Medicare is going to have a challenge with. Now, when do you apply for Medicare? And this is a question that we try to address with our clients, especially as they get closer to age 65. Now, you are, as an American or as a retiree, you are eligible for Medicare benefits in the month that you turn age 65. But although you're eligible for Medicare benefits in the month that you turn 65, you have a 7-month initial window or initial enrollment period in which to sign up. So in other words, if you're turning 65, let's say in the month of July, you have 3 months prior to the month of July. Then you have the month of July, which happens to be the birthday in this example, and then you have 3 months after that. So that would give you a total of 7 months in which to sign up for Social Security. Now, if you're already receiving to sign up for Medicare, but if you're already receiving Social Security benefits prior to age 65, you will be automatically enrolled upon reaching age 65. The only time that you have to worry about that 7-month initial enrollment period for Medicare is if you have not elected to take Social Security as of age 65. So if you elected to take Social Security at 62, when you get to the age of 65, you will be automatically enrolled. But if you want to wait till age 67 or age 70 because you want to delay those Social Security retirement benefits, then you must pay attention to the 7-month initial enrollment period that all of us need to deal with. Now, if you happen to delay enrollment, then you're going to have to pay a higher premium. More than likely, you'll pay an additional 10% of premium, and that 10% of premium is paid for your entire life. Now, when to apply for Medicare? And obviously, there are a couple of choices, and there are a couple of pathways you can take when you're getting ready to apply for Medicare. Now, if you want to take the first pathway, you can sign up for hospital insurance, which is Part A, which, by the way, you don't pay a premium for Part A because you've been paying Part A premium throughout your working years. So you'll sign up under Pathway 1 for hospital insurance Part A. You'll sign up for medical insurance Part B. And then you'll sign up for prescription drug coverage, which is Part D, or group health plan. And then obviously on top of that, you may want to sign up for supplemental insurance, and that's if needed. So that would be path 1. Hospital insurance, medical insurance, prescription drug coverage, which is Part D, and supplemental insurance if needed. You can also choose pathway 2, in which you sign up for Medicare Advantage Part C. And if you sign up for Medicare Advantage Part C, that will automatically cover, hospitalization, medical, and prescription drugs. So you have a couple of choices, and obviously, as you get closer and closer to retirement, you need to work very closely with your advisor in order to make certain that you're making the right decision at the right time and for the right reasons. Now, let's talk a little bit about Medicare choices. And this is what we call the Medicare ABCs and Ds from a business standpoint. Now, Part A, that's hospital insurance. And basically what's covered under hospital insurance would be inpatient services like hospitalization and so forth, skilled nursing facilities with limitations, and that's very critical to understand. Skilled home-based and hospice care, but it's not long-term care, so it's for a very short period of time, and Americans need to be cognizant of how long that coverage would be, because it's not going to be very long. Most cases, it's not going to be more than 120 days altogether. Now, under Part A, what is it that Americans will pay? Well, you'll pay, there's not going to be a monthly premium for Part A hospital insurance because you have already made those contributions while you were employed, but there will be a yearly deductible. There are going to be daily copays for the first 150 days of treatment. So there is a minor cost to Part A, but it has nothing to do with paying a monthly premium for that coverage. Then we get into Part B. So Part A is hospital insurance. Part B is medical insurance. And medical insurance covers doctors and physician services, preventive benefits, durable medical equipment, outpatient services, and the like. So there's a lot of stuff that Part B does cover, and it's important to know what the coverages are there as well. Now, what you as an American or retiree pay, obviously for Part B, there is a monthly premium that needs to be paid. There's also a yearly deductible. You're also going to have co-insurance or on physician services, and also you may have a co-insurance on outpatient care as well. So that's very critical to also understand, because that adds to the cost of Medicare in retirement. Now that brings us to Part D, which is prescription drug coverage. And that was approved several years ago under the previous presidency. That was George W. Bush that pushed for Part D prescription drug services, because prior to that you had Part A, B, and C. But Part D covers plans that are offered by private insurance companies, and they must be approved by Medicare, and there's a number of those that are available. So as you get ready for retirement, your advisor can provide a list, or if you want to engage our services, we'll be able to help you along those lines. But these are plans that are offered by private insurance companies that are approved by Medicare. And covered drugs vary by plan, so you can pick and choose the type of plan that you're interested in going with, depending on your personal and healthcare needs. Now, what you pay for, obviously you'll pay a monthly premium for Part D. You will be paying yearly deductibles as well. Co-pays before and after the coverage gap, quote unquote, that you must meet. But obviously you'll have some discounted costs within the coverage gaps that will help you to offset a little bit of that cost of buying prescription drugs on a regular basis. Now you also have the option, and that was pathway 2 that we talked about briefly a little while ago, and that was to choose Medicare Advantage. Now when you choose Part C, which is Medicare Advantage, again, a number of things are covered under that scenario. It is offered, again, by private companies approved by Medicare, but it includes, it's like a bundle plan. It will include Parts A and B. Most plans will include Part D, and may cover hearing, dental, and vision treatment as well. So, Part C, Medicare Advantage, will kind of give you that bundle approach if you don't want to go through the cafeteria plan of the previous ones that I have mentioned. Now, for this, you will pay a monthly premium for Part B, and you will also pay deductible and co-pays, and that will vary based on the type of plan that you choose, and there are many of them that are available for you as well. Now, obviously, in any type of healthcare coverage, there are going to be gaps and consequences that retirees are going to have to deal with. So obviously you can engage a company where you can buy supplemental insurance, or you can maintain your existing employer coverage. Now, something interesting about this area is that only 1 in 6 employers actually offer healthcare insurance coverage to Medicare eligible retirees. So it's about 17% of the companies, the good companies that provide health insurance services, will actually offer insurance coverage to individuals who are still employed and that are eligible for Medicare services. So that's something to be careful about. Make certain that if you work for a company, that you take a look at their healthcare services and all the clauses that they may have in their contract when it comes to retirees. If you happen to work for a company that may offer those services to you, then obviously it would behoove you to make certain that you take a look at what the coverages are, what are the benefits, what is the cost, and then compare that to something like Medicare Part C from that perspective. You can also acquire retiree health insurance coverage. And these are offered voluntarily by companies who control the coverage. The enrollees are responsible for paying the premiums, the co-pays, the shared costs, and deductibles. You may include spouses, but the spouses must be enrolled in Medicare as well, and so will you as the employee. Now, you also have a number of Medicare, what we call Medigap plans, that assist our clients and our retirees in covering the gaps that Medicare will not cover. Now, Medicare plans, in order for you to qualify for them, you must be enrolled in Medicare A and B to qualify. Spouses must have separate policies altogether, and monthly premiums paid to the insurance provider in addition to Medicare Part B premiums. Prescription drugs are not covered, but may be available through Medicare Part D as well. So Medigap plans, there are a number of them are available. Be certain that it changes from locality to locality. So depending where you're going to be in the United States, take a look at your zip code, and from there you'll be able to find out which plan may be more suitable for you. There are companies that specialize in certain areas. Geographical location becomes a major issue. So it is not a one-fits-all type services. So you have to make certain that either you do your due diligence, or you have a conversation with a financial advisor, or your financial advisor, or someone that specializes in retirement planning and retirement distribution. Now, as far as what the cost is for Medicare, I'm just going to use an example of, let's say, if we have someone that has a modified adjusted gross income in retirement below 170,000. So this is someone that has a modified adjusted gross income of under $170,000. This is a healthy individual or healthy couple, and they have no additional health care costs that could increase that cost overall. Basically, for Part A, there's no premium, so the cost there is going to be zero. Part B is going to be $104.90 a month, or $1,258.80 a year. Part D will have a cost of about $37.20 a month, or $446.40 a year. And then the Medigap plan, which is the one that covers all the gaps that Medicare will not cover, that will have a cost of about $186 a month, or $2,232 a year. So if you happen to be an individual and you're not married, your monthly cost could be as high as $328.10 a month, or $3,937.20 a year. I mean, that's not chump change. Obviously, Medicare will increase those costs depending on your income level. So the more money you make, the higher Medicare cost is going to be. So make certain that you pay attention to that. If it's a husband and wife and they file jointly, and their modified adjusted gross income is less than $170,000 a year, then they're going to be paying approximately $656.20 per month, or $7,874.40 per month. Now, one of the areas that is very critical to understand is that depending on the income that you generate when you file your taxes, and we're talking about your adjustable gross income, depending on that income, that's how your Medicare cost is going to be figured out for you. And obviously the government is going to do that. So the more tax-free income that you receive in retirement, the better off you're going to be, because you're going to be able to keep your reportable income as low as you possibly can, and therefore your Medicare cost is going to be lower than for most. For many of our clients that have at least 10 years before retirement, or anywhere close to 10 years, I mean, 10 years would be the sweet spot there. If it's 15 years, even better. If it's 5 years, well, we have to accelerate and do some additional planning. But if you have 10 years away from retirement, then we can do a lot of proper planning whereby you can start shifting a lot of that income to tax-free income that will not be reported as income on your tax return, and therefore it's not going to have a negative impact either on your Social Security benefits or your Medicare benefits and or cost moving forward into retirement. Now, one of the critical things about Medicare deals with the issue of long-term care. And as I said earlier, very little of it is covered by Medicare. As a matter of fact, most of it is not. So the challenge is that 7 out of 10 individuals over the age of 65 will need long-term care at some point in time in their lives. And the challenge for that, and the challenge for many of my clients, as they start to approach us and talking about retirement planning and retirement distribution, they have really never considered the cost of health care, not only the Medicare cost, but also the long-term care cost, because of the fact that people are living a lot longer today than they ever did before. So, if you happen to make it to your mid-80s or late 80s or early 90s or mid-90s, you may still be alive, where otherwise maybe 30, 40 years ago you would have been dead at that point in time. But the challenge is you may not be as healthy. You may need long-term care services, and the cost of that is going to be prohibitively expensive in the future. Now, one of the key questions is where long-term care happens in the United States. Well, 51% of the people in long-term care happen to be in what is called home health care. This is where you're receiving that care at home, and you would qualify for benefits under those premises. Now, obviously, to qualify for benefits, you have to make certain that you cannot perform two of what they call the ADLs, the activities of daily living. So if you have to be fed or bathed or continence or stuff like that, then you will qualify for certain benefits that either your long-term care policy or your Medicare for the short term may be able to cover in your behalf. So 51% of the services being provided in home health care. 18% is being provided in community care, and community care is where a number of retirees that need care go there on a daily basis. So it's like a daycare center for the elderly, and obviously 18% is being provided through community care. Now 31% is through nursing home, and usually when people are in nursing home, then they're at a point in time where either home health care service has already failed, or it has done its job up to a certain level, and it can no longer go further. 18% in community care has also failed, and now last but not least is nursing home, where you're going to get 24/7 coverage in care and patient care along those lines. Now, long-term care treatment can easily approach and or exceed $200,000 in a lifetime, and that's a lot of money. And the challenge for many of the retirees that we're engaging as they prepare for retirement is they have never taken any of these issues into consideration when they were thinking about retirement planning. Now, generally, Medicare will not pay for long-term care insurance costs or services, and when it does pay, it's only going to pay a very, very small portion. Now, longevity planning, and this is a conversation that we have all the time, longevity planning is the most critical issue of the 21st century. I mean, it's not terrorism, it's not any of those things, it's longevity planning. Why? Because people are living a lot longer today. As a matter of fact, the fastest growing population in the United States today are those individuals between the ages of 85 and 105. So, by the same token, long-term care costs differ depending on the type of service that someone may be receiving in a long-term care facility. So, for instance, if you're receiving care in a home health care, it may run, at least in the state of Florida, just north of $98,000 a year. Still, that's a tremendous amount of money. Now, fast forward, if you happen to be 65 today and you're healthy, fast forward the increase in those costs by at least 6%. So anywhere between 6 and 8% on an annual basis over the next 20 years, and see what that cost is going to look like 20 years from now. So obviously, the key thing that I talked about earlier, where, the question is, you want to make certain that you don't run out of money before you run out of life. If you have a long-term care need in your family, if you're married and either you have a need for care or your spouse has a need for care, or both of you may have a need for care, you can actually drain hundreds of thousands of dollars in a very short period of time. So home health care in Florida, it's north of $98,000. If you're in a adult care daycare facility, it'll run around $81,000, $82,000 a year. If it's an assisted living facility, what they call ALFs, it's going to run somewhere about $192,000 a year. And if you happen to be in a semi-private room at a nursing facility or a nursing home, it can run closer to $202,000 for that care. And if you want a private room in a nursing home as well, that's going to run north of $226,000. So the cost is quite expensive. Proper planning needs to be done for that. And sometimes what I get from clients is, well, Bert, if I ever get to that point, couldn't I just go and apply for Medicaid? Because if I do apply for Medicaid is going to take care of all that cost for me or my spouse. And the question is, well, is Medicaid a solution? And the challenge is, well, it depends. First of all, to qualify for Medicaid, the annual income must be below or near the federal poverty level. So it's almost non-existent, and that changes through inflation on a regular basis, but at least every 2 to 3 years. But your annual income needs to be very low. Your assets need to be less than $2,000. There's a 5-year look back on assets. Obviously the government wants to make certain that you're not shifting assets to someone else or some other family member in order to make you eligible for Medicaid. And qualifications do vary state by state. Some states are more strict than others, but I think it's critical to make certain that you pay attention to that depending on the state that you're going to be living in. Now, long-term care has a tendency to affect women more so than they do men. And the reason for that is the life expectancy for women. It's approximately 86.6 years of age. Now, you probably have heard someone talking about life expectancy, and the question is, well, what's the definition of life expectancy? So the definition is as follows. If you're a female today and you're age 65, and your life expectancy is 86.6 years of age, it basically means that all 65-year-old women today in the United States have a probability of living to age 86.6, except for the following. The ratio on the life expectancy means that 50% of that group, in other words, 50% of all those women that are age 65 today, will be dead by age 86.6, but then the other 50% is expected to be alive at age 86.6 and longer. So for men, it's a little bit less, it's 84.2. It has been creeping up more so a few years, like 10 years ago. It was back up into the late 70s for men, early 80s for women. But again, people are living longer today. So you have to be careful about life expectancy because it's kind of tricky. And the reason for that is, which side of the equation will you find yourself on? Which side of that fence are you going to find yourself on? And you really don't know. If you happen to be that 65-year-old female today, there's a 50% probability you're going to be dead before age 86.6, but there's also a 50% probability that you will not. So you have to plan as if you're going to be alive for the next 3 decades if you're 65 years of age, and do the proper planning, not only for Medicare and long-term care and Social Security benefits, but also for retirement planning and the like. As I said earlier, the fastest growing population in the U.S. are individuals between the ages of 85 and 105. As a matter of fact, for life insurance contracts a number of years ago, most life insurance policies would endow at age 100. None of them do anymore, unless you just happen to have one of the very old ones. So now most life insurance policies endow at age 121. And again, the reason is that people are living a lot longer today due to medical technology than they've ever had in the past. Now, some of the things to pay attention to as you prepare for retirement or you start planning for retirement regarding healthcare cost is what's going to be the cost of long-term care in the future. The fact that women are twice as likely to file long-term care claims. Women actually are the majority of nursing homes and ALF, assisted living facilities, patients. So the majority of patients in ALFs and nursing homes are women. And there's a reason for that. They have a tendency to live longer. Women are likely to be on long-term care claim longer than men. And women are twice as likely to exceed a 3-year claim. So the average of long-term care, once you get into a nursing facility, nursing home facilities, anywhere between 2 and 3 years, well, women have a tendency to go longer than 3 years. So again, proper planning has to be done. What happens if you can no longer pay for long-term care services and you can no longer be in a nursing home, but you need that care? What's going to happen then? Now, your income may be above a certain threshold that you may not qualify for Medicaid, but now you're putting a tremendous amount of pressure on your family. They're going to have to take care of you. Who's going to provide the care on your family, and how is that care going to be done and provided? And is it going to be the type of care that you're going to need? So the issue of retirement planning covers a lot of different areas that we will be sharing with you in other podcasts, and we have already started doing many of those in our previous podcast. But some of the final thoughts that I have for you today is that, retirement and longevity planning complexities far exceed the understanding and comprehension of most financial advisors. So I deal with financial advisors all the time, and they're only thinking about accumulation. They're training themselves, and the companies that they work with train them on accumulation strategies. They don't train these advisors on distribution strategies, and that's one of the major differences that we have here at Cambridge, where we specialize in retirement distribution planning. Now, think of it this way. If financial advisors, are having a very difficult time understanding retirement distribution and longevity planning, can you imagine how the American public feels about that? The majority of clients that I engage as they come into my office to prepare for retirement, they think they have everything down to a science. And when I start to ask questions and we start to address certain issues and concerns, many of them want to start working all over again because, it was a lot simpler then. But obviously that's not the case. Now, one of the things that I hear all the time from clients that we engage, they use the axiom that, I'm going to be able to be okay in retirement because some of my expenses that I have now are going to go away in the future. And from an economics perspective, none of these expenses are ever going to go away. So most pre-retirement expenses never go away. They just get shifted or replaced by other post-retirement expenses. So yeah, you may not have a mortgage payment because your house may be paid off now at age 65, but you have all other expenses like Medicare premiums and so forth along those lines, and co-pays and the like. So again, these are just some of the things that are never going to go away. They're just going to be shifted, from one side of the ledger to the other one. Now, economic principles are paramount in creating proper distribution income stratos that protect the risk of living too long, along with the risk of living with a disability. And part of the work that we do in retirement distribution planning is, to make certain that we can create economic stratos. And that's nothing more than bringing the right products and the right services that can provide the shelter and the risk tolerance to make certain that if a client or a family happens to live too long or live with a disability, that they're fully protected. And obviously at the end of every one of our webinars and our podcast, I have the same saying that I always use. Our number one goal here at Cambridge, for those of you that are listening to our podcast on a weekly basis, and many of you do so, is to kind of change the way that you see things. Because when you do change the way you see things, the things that you see change. So again, thank you very much. Glad to have you with us today. Stay tuned for next week's episode, and we'll communicate that to you. And we'll do an episode for the rest of the year, every single week. And then starting in January, we'll continue to do the same for every year thereafter. Thank you, and have a wonderful day.